Howdy, healthcare people. You're listening to the Analytical IQ podcast. I'm Adam Lorton.
And I'm Hyunmin Kim.
Today we're talking about price transparency and price shopping in healthcare. Specifically, we're responding to a question from Russell, who's a member of our email list. Russell writes, I'd like you to talk about software-generated cost estimates for known diseases and procedures. We have the data, and we also have the data on complications and variations. There's no reason why an estimate can't be generated and the patient percentage of costs can't be given ahead of time. When a patient knows what the out-of-pocket costs will be, they can make decisions and shop around for non-emergency procedures. Russell continues, I had lung cancer and had my left lung removed several years ago. I continue to be shocked by A, what's covered and not covered by my insurance, and B, just how much everything costs at the end of the day. Russell, thank you for your question, and I'm very glad you lived to tell the tale. Hyunmin, you are an analyst in training, so you have maybe a little bit more beginner's mind on this than I do. Not to mention, you also grew up in a country where everybody had government health insurance. So when you read Russell's question, what was your first reaction?
Sure. So I don't know if anyone shares the same sentiment as me in the United States, but I find it almost out of my imagination that someone would not be able to figure out their cost before they get their service. And I thought, oh, maybe it's because, the healthcare in the US is so expensive. So it's like a psychological game that you get your service first and then you get quoted. Because, back home in Korea, the copays are minimal. So no one's ever scared to get their bill. So that was my suspicion, but I have no way of telling.
Yeah. So my initial reaction, unfortunately, as a industry insider, I suppose, was that this is exactly like everything I encounter in healthcare data, which is you hear an idea and you say, holy cow, it's 2020. We have iPhones, we have Teslas, we have machine learning algorithms, but we can't do that. All right. And so before I get into the specifics here, I just want to be really, really clear. I think if we had better price transparency and if we could price shop, that would definitely help lower the cost of care. I don't think it's the only intervention we need, Russell, but yes, 1,000 times yes. It would be good for consumers. It would be good for the federal budget. I think there are a few obstacles to price shopping in healthcare. Although there is some government action on the way right now that could be helpful. So Hyunmin, I think you're going to think that I'm exaggerating this story for effect, but I promise I am not exaggerating. I'm just telling you the unvarnished truth about how healthcare billing works in this country.
Okay.
So there are a couple of what I would call data translation problems inherent here, and also kind of a legal competitive secrecy problem. So I'm going to take a real simple example and walk through it. Let's say you have pain in your lower abdomen, maybe like a bulge. So you go to your primary care provider. Let's call her Katie. My friend Katie is a primary care provider. All right, so you go to Katie, and she's like, oh, easy diagnosis. That's a hernia. And good news, this is one of the most routine surgeries known to medicine. I know a great surgeon. She's done 50 already this year. I'll make the referral. Not so fast, Katie, you say. I want to price shop this. Just tell me exactly what procedure I need. I'll ask around. So at this point, what's Dr. Katie going to say? She's going to say, how the hell should I know? That's the surgeon's job to tell you exactly what procedure you need. So you go to your surgeon, or the recommended surgeon. You're going to price shop this, obviously. Let's call her Elizabeth. And Elizabeth is saying, all right, based on what I'm seeing from you, you're going to need we call this in the business a 49520. That's one of the 20 codes you can build depending on how the surgeon wants to repair your hernia. And so Elizabeth is saying, yeah, for that, so I'm going to bill your insurance company a completely made up number, and that number is called charges. Your charges will be $1,400. And then the insurance company is going to disregard that number, and they're going to pay me whatever their fee schedule says for a 49520. So now look, I'm not supposed to tell you what the fee schedule is, but You seem like a well-meaning healthcare consumer. So I'm going to guess I'm going to get, let's say, $600 for that. So $600 is what the actual cost. And then whatever your deal is with your insurance company, you just pay your percentage of that $600. So if you've got a nice health plan, maybe you just pay 10%, $60. Or if you've got a less good health plan, maybe you'll pay the whole 600. But that's it, $600. And so you say, $600? I actually thought it was going to be a lot more than that. And then your surgeon, Elizabeth, she laughs in your face. She's like, of course it's more than that. That was just the professional bill. I'm going to send you a bill for my services, but you haven't even asked about the facility charge. The facility charge? Yeah.
This sounds very familiar.
No, this is all true. So Elizabeth, the surgeon, is telling you, I'm going to do the surgery, but I have to do it in the hospital. So the hospital is going to charge you too. So you need to go ask Kit in the hospital finance department how all this works, because frankly, I have no idea. I don't do hospital billing. I'm a doctor. You go to Kit in the hospital finance department, and Kit says, oh, Elizabeth said you're going to need a 49520 hernia repair? Great. The hospital is going to bill the insurance company for that. We will bill them $7,500. All the color drains from your face,
Wow.
right? Noticing your discomfort, Kit is going to reassure you. Don't you worry. That's just charges. It's a made-up number. The insurance company is just going to pay us whatever is on the fee schedule. Now, I'm not supposed to tell you what's on the fee schedule, but you seem like a really well-meaning healthcare consumer. So I'm going to guess that the real amount is like $2,000. So whatever your deal is with your insurance company, you just pay your percentage of that $2,000. All right, so you're starting to add this up in your head. Okay, $600 for the surgeon, $2,000 for the hospital, and then Kit rudely interrupts you as you're doing this math, and she reminds you, okay, but there are going to be a few more bills. You're going to need to pay for the supplies, the whatever implants the surgeon's going to use to repair your hernia. Let's say we're going to bill the insurance company $1,000 for that. Your total is $350. You got to pay the anesthesiologist, or we're going to charge $1,800. Let's say the insurance company is going to ballpark it at $550, and then you've got your pharmaceuticals, your drugs that we're going to give you in the hospital after the surgery for pain relief, and some other incidentals. Let's say $1,100 of charges, maybe $300 of actual payments from the insurance company. So let's just round that out at $4,000. So at this point, your head is spinning because you're like, wait, I have to go to a primary care doctor to get the diagnosis. I have to go to the surgeon to get the surgery prescription, for lack of a better term, but the surgeon can't tell me what the total cost of the procedure is going to be. Neither can the hospital. I have to triangulate that between the surgeon and the hospital that they want to use. So if I wanted to price shop this thing, I'm going to 3 different surgeons, and maybe they all practice at the same hospital, so the hospital charges will be the same. And God forbid a patient would know the difference between a hospital outpatient facility and an ambulatory surgery center. But the ambulatory surgery center might be less expensive depending on the procedure. Will certainly be less expensive if the procedure is offered at the ambulatory surgery center. So Russell, oh, by the way, I'm not done. Also, they would never disclose their fee schedule because the insurance company prohibits them from doing that, because the insurance company knows that if hospitals can see each other's fee schedules, well, then hospitals would have more negotiating leverage against the insurance company.
Why is that the case?
Now I'm going to get myself into trouble because I only pretty sure I know the answer to that. I'm pretty sure that it's written in the contract that the hospital can't publish the actual fee schedule they get from the insurance company.
Okay.
Precisely because the insurance company doesn't want hospitals just, comparing fee schedules with each other for extra
Isn't
negotiating
fee
leverage.
schedule just a timeline? Does it have...
No, sorry. A fee schedule is like a list of all the different healthcare procedures you can bill for and how much the insurance company will pay for each one.
I see.
Yeah. So one hernia repair, laparoscopic on the left side of a X type of hernia. Oh, okay. $2,000.
But is it like a collusion between insurance companies that they won't disclose their fee schedule? Because I think that's part of the problem too.
I would certainly call it monopolistic behavior. Collusion would imply that the insurance companies would like getting to get, I guess you could argue the insurance company is coordinating with the hospital to keep prices high. So, I mean, I think at its most charitable,
Mhm.
it's a type of contract that's not for necessarily for the public's good. And at its worst, you could call it anti-competitive.
Right.
And all of this might be changing January 1st, 2021 because
Oh, what's
of
happening?
because of the Trump administration. They're doing something right. So, starting January 2021, price transparency actually is signed by an executive order and it goes to another level. So, right now, if you go to any hospital's website, somewhere buried on their website, somewhere out of the way, not where the general public can easily find it, you can find what's called their charge master. Now, so I was talking about charges earlier. This is the completely made up numbers, which is we bill the insurance company X and then they give us back 30% of X or 40% of X, depending on what the charge is. So
Mhm.
hospitals publish their charges, but of course those numbers have basically no bearing on reality. The reason why charge masters exist in the first place is the short answer is because there's a rule that you can't bill the federal government more than you're billing a private insurance company.
Mhm.
So they bill them all the same absurdly high numbers, but then they all reimburse at different rates.
Oh.
Okay, but so right now, hospitals have to publish their charge master, but starting next year in 2021, they're going to have to publish more. They publish the charges, but they also have to publish their discounted cash price. So that is, if you're a person who doesn't have health insurance and you want to pay cash, what is the dollar amount that the hospital would accept for that? They also have to publish the rates that they have with their payers. So they call it payer-specific negotiated charge. They have to publish in a field called de-identified minimum negotiated charges. So that's the lowest charge that a hospital has negotiated with all third-party payers for that particular item. And then de-identified maximum negotiated charges. So the highest charge a hospital has negotiated with all third-party payers for an item or service. This is exciting
Right.
because now, if we go back to this potential hernia situation, price shopping is possible. So the way that I expect hospitals will try to game the system a bit is that you might look up how much it will cost to do the hernia procedure. Oh, sorry. Let me continue reading the rule. Hospitals must display this for at least 300 shoppable services, including 70 that are specified by the government and then 230 that are chosen by the hospital. So you have to publish your prices for at least 300 services, and they have to be, common services that you routinely deliver. But so we got to those line items there. There's the anesthesia charge, the surgeon charge, the operating room charge, the supplies charge. So if something they do all the time is a hernia replacement, maybe they'll publish a really cheap price for the hernia replacement, but then they will shift that cost into the cost of supplies, and maybe they won't, maybe surgical supplies won't be in that top 300 list that they publish. So that is how I'm expecting them to game the system. However, I applaud the administration for taking this step because I think it's a step in the right direction, even if it's still a system that can be gamed.
Right. Because you can get a accurate measure of part of your bill, but
Yes,
then a large part of it could be hidden and give you a blow later on.
it could be. And luckily, more and more providers are going at risk for their patients. And when you're at risk for your patients, it benefits you to provide low cost services, as in, you make more money when your patients spend less money. So,
Mm-hmm.
the hospitals that are still on fee for service, the more traditional the fee for service, the more cost shifting and just like disguising their charges I would expect. And the more these providers are at risk, the more they're going to want to have low prices and publish those and advertise those low prices. I think the trend of providers going at risk is helpful and
Mm-hmm.
coincides nicely with price transparency.
Yeah, that's really interesting. So when you imagine price shopping in medical services becoming a reality,
Mhm.
do you envision individual customers being able to shop for all of these things, or more like just because we have all these informations to disclose, you would be able to select a health network that have a generally lower price? Because if you are price shopping for all these individual things, it's good to have that option, but the logistics of like getting this surgeon, this anesthesiologist, some people just don't have the means to do that. So when you say price shopping becoming a reality, like what version of it do you envision?
Sure. Well, actually, there's already pressure on the provider networks, the ones who are at risk. There's already pressure on them to recommend low cost surgeons, for example, to their patients.
Mm.
I think there's a potential for a virtuous cycle there, where that surgeon Elizabeth does high quality hernia surgeries for a low cost. So I'm going to refer all my patients to her. So I think that's a good potential outcome. I do think the evidence we've seen, and you've been quick to point this out, Hyunmin, is Americans like to have agency in this thing, even something as complicated as medicine. So I think there are going to be a lot of people who want to do their own price shopping, even knowing that their information is imperfect. There's some feeling of it. At least I got to choose. I think, like Russell was saying, we already know how much these services cost to deliver, and as a matter of fact, who knows really well how much basically everything in healthcare costs to deliver?
Who is that?
The federal government. They've been measuring this for years. And so, do you know what would be even more price transparent than a bunch of private payers, and let's say streamlined, integrated, what's the other word I'm looking for? Oh, incentives aligned with risk healthcare providers? What would be more transparent than those things?
Government transparency?
Yeah, just one single payer paying for everything.
Right. Why can't we do that here in the United States of America?
That's a point we seem to keep coming back to.
Yeah. I mean, I'm not trying to urge US to like fundamentally change its psyche. Yeah, but coming from a country where we have universal single payer healthcare and knowing that we don't have to agonize over all these issues, like Russell wouldn't have his question if he were living in Korea. Maybe some other set of questions, but definitely not this one. Um, so yeah,
Exactly. How much
it's
is my plane ticket to San Francisco for my
oh
lung
my
surgery?
God. Yeah, those kind of questions.
Yeah. All right. We seem to have landed back where we always seem to land. Russell, I really appreciate the question. If you are listening to this and you'd like to get in on this conversation, then you can head to analyticaliq.com and join the email list where you can send questions directly to us. Until next time, I'm Adam Lurton.
I'm Hyunmin Kim.
Thanks for listening. Talk to you later.
Bye.